Hi, welcome to NUR 447 Pediatric Nursing. My name is Brian Warmers. I'm going to be the professor of this course. And for this recorded lecture, it's just going to be an overview of the syllabus and briefly of the LMS features of this course. I will make a separate one that is going to cover the clinical schedule. So, starting off with the syllabus, once again, this is NUR 447 Pediatric Nursing. This is a face-to-face method. We are transitioning out of COVID and into being there in real time. I will emphasize that it's really important that you make it to class and that you show up and that you participate. There's not going to be a lot of makeup assignments or extensions as we are transitioning as a university away from how we were during COVID. So this, of course, is me. This is my office. This is my phone number for both my office and this is my cell phone. So I give you my direct cell phone number. You probably have my email already. These are my office hours. This is in person for me from 11 to 1 on Mondays and Fridays. If you want to meet via Zoom or some other fashion, just give me a text or a call or give me a heads up and we can meet that way, especially if I'm in office. It's usually not a big deal, but I am here in person, live on Mondays and Fridays in my office. And then, of course, if these don't work, I can make an appointment outside of those hours. So, course description, surprisingly enough, we're going to be talking about children. And so this is just going to be a brief introduction to care of the child and the family, promoting normal growth and development, looking at periods of illness. We'll also talk about cultural issues and how it's a vulnerable population. Nurses are mandatory reporters, and that part of it will be explored, especially when we talk about child abuse. Clinical experiences will include some physical assessment of children in various developmental stages and interviews and caring for children in the hospital, looking at, you'll be doing a health fair, and you'll have some simulation. So this is our university credit hour policy, so you can learn about that and what that means for you. On ground, so this is going to be in class, so attendance and participation are key to your success. These are the learning objectives of the course. So once again, we're looking at children and their family. That's a big component of pediatrics, is not just the child in isolation, but how that child functions within a framework. We'll look at the child as a client and their developmental attributes. So we're going to dust off some of your developmental psychology and what that all means. We'll look at family as a client and how that, plays a role into how we care for these families. We'll look at variables that, put the child at risk. What makes a child more at risk for certain attributes and for certain injuries and illnesses than, say, adults. We'll look at health promotion of children and families. We're going to look at professional and developmentally appropriate manner to communicate with clients. We're going to do, good old H&Ps, physicals and histories. We'll look at the dynamics of the different developmental stages. We'll talk about family-centered nursing, and we're going to start demonstrating some skill in caring for kids, both acutely, chronically, and in a life-threatening disorder. So for accreditation, we have AACN domains that we cover in this course, and you can feel free to read through those. Required resources, APA book, you should all have these already. Your ATI book, and then this is the joint PEDS maternal book. This is required to have. The online resources are nice to have, but they are not mandatory. And this is a reference for you. Evaluation for this course, we do have 3 examinations at 63% of your total grade, which is less than, say, med surg, but it's still significant. You will do a family interview and assessment paper. You'll do a physical and developmental assessment. You're going to do teaching plan that you'll do during clinicals. You'll have 3 concept maps coming from your clinicals. You'll have quizzes throughout the course, You'll have some online discussion questions, soft check participation. You're going to have simulation and class participation. You're going to have ATIs, both practice and proctored, and then culture for service, as you do with all of your clinical courses. So with this, some of your clinical component, like I said before, you're going to be on a pediatric floor, whether at Sanford or Vera. You'll have simulation with me in our simulation room. You will do the Health Connect Fair, and I'll get to that in a bit. You will attend a child abuse conference, and you'll do a teaching project while you're at clinicals. So grades, these are what you've always had in nursing courses. So you can look at your passing grades here. You do need a B- to advance within the School of Nursing. So traditional service learning policy and procedures, academic honesty, please don't cheat, compliance with the Americans with Disability Act. So if this applies to you, please contact this phone number or this email address. Program assessment, IDEAs will be done at the end of this, and we look at those and try and improve our courses every year. Copyright, make sure you're crediting those people that have come before you and put in the work. And status of the syllabus, I'm hoping nothing changes, but I will keep you updated if it does. So I laid it out in different weeks. So this is your intro to the course and review of the syllabus that you are listening to right now. So I will say that this is specifically for NUR 447B, so pediatric nursing for the traditional students that will graduate in 2023. So you can take a look at this. There are soft talk modules covering 21st century pediatric nursing, family-centered care of nursing, pediatric variations of nursing. These are all important for you to review. You'll have readings, soft talk module, soft talk module, soft talk module, et cetera, et cetera. You're going to have some uploads here for Castle Branch, and then you got to upload your one chart saying that you're compliant with all those different training that they make you do. So this first week is kind of getting some of the basics for pediatrics, and then basics for clinicals, making sure you're up to date. Week 2, we'll talk about child development. We're going to talk about family, social, cultural, and religious influences on children. So I want you to have all these soft talks for week 2 and beyond done prior to class. That way you have an understanding of what we are doing and what we'll talk about. So for these weeks, I did give you some leniency till Sunday night, but then starting here, I want you to go through all this information and have an understanding of what we're going to be covering. We'll also be talking about, health promotion online and what influences what influences there are on children and their families. So this is always kind of interesting because if you think about it, we all have different backgrounds and we were all raised a little differently. So it's coming to terms with that and having an understanding that there are multiple different ways to raise children, and what everybody thinks is right is often what you were raised in. There are a few exceptions to that, and there are definitely some people that I know that they believe that how they were raised was incorrect, and they want to make sure that they don't raise their kids that way. But every family is different, and seeing that is a huge part of this course. So Labor Day weekend is 9-5, no classes then. So I'll record a lecture on communication history and physical assessment for the traditional students on that. Got quiz 1 right away. So, and then a soft chalk, surprisingly enough. Then we'll cover family theory, respiratory dysfunction. So once again, those things have soft chalk modules as an introduction to the course, and I want you to complete them. You will have some clinicals by that time, and I want you to do a concept map prior to then, or due on 9-18. I believe all of you have done concept maps. Follow the instructions, make them messy. It is fine. I want you to, put everything together. You're going to have lots of lines, lots of connections, and that's part of it. Week 5, we've got exam number 1 already. That's going to be covering 1 through 3. It will not cover respiratory, but it's going to be a lot of your basic theories of, caring for children, child development, those type of things. It's your background. So from there, then we will go into specific systems-based type of situations. So um, then we're talking about respiratory. You will have a Health Connect fair. I'll talk to you about that a little bit more on another recorded lecture for the clinical portion of this. But realize that this is on a Saturday, and it's actually from 11 until 3 p.m. But I think I said on the clinical schedule 10 to 4. That allows you for cleanup, setup, and tear down afterwards. So it's not quite the 1800 like this says. Cardiovascular dysfunction, I think you have an understanding what that means in adults, but guess what? In kids, it's a lot different. We usually don't talk about heart attacks and strokes in kids. We talk about, birth defects and congenital type of things and acquired cardiac diseases. So this week we'll be talking about that. I want you to post after your Health Connect Fair. What did you like? What did you learn from this? You'll be doing some child abuse reading. So this will be on course reserve at the library. And then I want you to post on that. You'll have your simulation done by October 2nd. So please have your reflection journal due at this point in time. And then your concept map 3 and your last one's done. Week 7, so child abuse conference. So we will meet and talk about HEME. And then 6th and 7th is the child abuse conference. And I'll talk about that more in the clinical one. But that will be a full day on Thursday and part day on Friday. These will be the readings that go along with it throughout your ATI. Here's your soft shock module and quiz 2 will be due. This week's fall break. Basically, I'm giving you some time to work on some of your physical development and assessment assignments. Your children abuse conference, so I want like a reflection off of what that was. And then family interview assessment. So this week I'm giving you basically time to do your assignments. Week 9 we'll talk about cerebral function. There's soft shock that goes with it, quiz number 3 that goes with it. And then week 10 we're going to have exam 2. So that's going to cover, respiratory through cerebral. So weeks 4 through 9. Then after that, then we'll start talking about endocrine and pain. We'll talk about GI, GU with associated soft shocks. We'll have a PEDS Med Calc. So this is a long test. This is 90 minutes talking about calculations. So you might want to brush up on that. How many ounces are, in a pound? How many teaspoons make up a tablespoon? How to convert from milligrams to grams to micrograms? How to do weight-based calculations. So if your kid is this many kilograms, actually if this kid is so many pounds, to convert it into kilograms per dose. So most people find that if they review it, it's helpful because they've forgotten some of those things. Week 13, talking about neuro, musculoskeletal. Your ATI practice tests, you get the best of 2 attempts, just like in med-surg. Those are due on this date. Chronic illness, disability, end-of-life care. We'll talk about pediatric emergencies, and then there's Thanksgiving break. We'll talk about cognitive and sensory impairment on children and family. We'll have proctored ATI exam. And then on this class time, we'll do an IDEA, wrap up some stuff. And then final is on Friday, December 9th at 10:30. And so it'll be over weeks 10 to 15 with some comprehensive content. So most of it will be on the new material, but I will pull a few things from previous stuff just to keep you honest. So that is the syllabus. Looking through and going back onto the website. So hopefully you figured out that the orientation of the course is right here, as well as the clinical orientation of the course will be right here. Here's the syllabus for you to check out. Here's our welcome. So talking about those things that you'll learn in the class. Course information tells you about me, office hours, email address for me, time of the class. Hopefully you've figured out by now. Clinical schedule, this will take you to a link, and we'll cover that link here in just a little bit in a different recording. Attendance, you don't need to worry about that. Course organization, some people like this. I don't really find it handy in my day-to-day stuff, but if you use it and you like it, great. Resources are broken down into downloads and soft shocks, so as well as some other links. This is a link for the Child Abuse Conference. We'll talk about that in the clinicals. Here's some clinical forms. This is your prep for simulation. These are your soft shock modules that are not scored, so you can go through these as many times in practice as you want. Whereas underneath the coursework page, when you do your soft shock modules, that gets scored. And if you review it and you get a lower score, then it reports the lower score. So if you need to review things on your soft shocks, make sure you go into here to the not scored one. Sim prep, like I said, development. So this is a developmental template. These are some study guides for exam 1, exam 2, exam 3. And that kind of lays it out for you. So the coursework, you can go in here and see all the things that are due, when they're due. I think we kind of covered briefly about, what is due. Gradebook, you can see your grades. Forum posting, you can see your forums. We do have a few in here. So some of it's just reflection. So this is a reflection from your post-conference child abuse. This is from Health Connect Fair. But we will have these two. So and that kind of covers a brief overview of the course, of the syllabus, and the LMS. So if you have questions on this, please feel free to contact me. I will see you coming up. I just won't see you this first week. So, all right. Have a great day.